afternoon, everyone. I'm Susan Kristiniak. I am the Associate Director of Palliative Care for the health system. And today I'd like to introduce you to our Integrative Care Kit. It's a new approach to increasing access and delight with integrative therapies at Penn Medicine. So let me introduce you to three patients that we came across. The first is Mrs. Gray with her partner attending their first prenatal class with their first child. Mrs. Smith and her husband sitting for the first time in one of our chemo infusion chairs. And finally, Mr. Jones, a patient who was on Silver 11, who with his family was waiting for transfer to our hospice care. What do all these people have in common? All are having new but very different Penn Medicine experiences that come with much distress, and not only with the patient, but with their caregivers as well. So we like to talk about integrative therapies. These are treatments defined by the NIH that are a group of diverse medical products, practices, and interventions that are not considered to be part of conventional medicine. But they focus on healing and wellness and address the distress of anxiety and pain with such treatments as aromatherapy, guided imagery, yoga, and acupuncture. This is an example of one of our nurses giving a hand massage to a patient at HOP, and in the past 18 months in a nurse-driven initiative, over 700 nurses have been trained to use this modality to give bedside care. And data from these practices have demonstrated that improvements in pain, nausea, and anxiety with self-reported changes in their Likert scales, offering either sniffers of lavender or orange or a lavender hand massage. This data mirrors NIH reports, and it also regulatory agencies like the Joint Commission have now added the value of relaxation responses in managing pain in patient-centered delivery of care. So we offer some of these modalities at Penn Medicine currently, but with limited access. We also realize that other institutions are offering similar access to integrative therapies, but with the burden of out-of-pocket expenses. For example, Cancer Treatment Centers of America require a prepayment for all their integrative care. So we believe we can increase access to integrative care services, not only helping patients to manage symptom distress, but also adding this concept of delight to their Penn Medicine experience. So this is not our new pet therapy program. However, delight, it's a driver of positive word of mouth. It's the unexpected that drives that delightful experience. So if you don't recognize this, you've never been on a cruise ship where the towel animal becomes the delight every time you re-enter your room. And when I've taken my family many times, it became the topic of conversation. Which animal did you get? I got this. And in fact, as silly as it sounds, it became a conversation of what cruise ship line we were going to take to make sure we had towel animals. So how can we deliver delight at no cost to our patients, at minimal cost to us, and create that positive word of mouth experience? So I had the privilege in the last 6 months of working with the innovation team and our team to create and design this kit and distribute it to 50 patients. Our care kits were complete with aromatherapy of lavender, ginger, and orange inhalers, lavender lotion, patient information on use, and a guided imagery download with earbuds to solicit a relaxation response through the listening. We branded it Penn Experience for comfort, rejuvenation, and relaxation, and distributed these to 3 unique populations that not only received the kit for themselves, but then we added a layer of their ability to create delight by gifting it to someone else who they cared about. All this for under $10 for the entire kit. So let's go back to our patients. Mrs. Gray, the new mom, immediately took sole possession of the kit when we handed them out in prenatal classes and asked thoughtful question of how she could use it for stress to improve her sleep. And all the while her partner was listening intently, I'm sure very motivated by all the same. Mrs. Smith received her kit at Valley Forge Infusion and was able to smile despite her new surroundings with her new toolkit for care. And she later gifted it to her daughter, who she knew has been really worried about her mom and her new diagnosis. Mr. Jones brightened when the kit was presented to him and stated, "I really need that," at a profoundly sad time for both the patient and the family, who were all gathered in the room. When we offered him a kit to gift, his wife immediately took it, identified herself as the recipient, and through tears and smiles thanked us for being so appreciative and hugged us as the care team, paying attention not only to her husband but to her family. Our team's distribution found a profound appreciation and almost a magical kind of transformation of patients' demeanor as we provided these small boxes of new ideas for care. So what did we learn? The importance of caregiver response receiving the kit created more delight than giving it to the patient alone. How valuable the element of surprise is in the delight factor, and would we lose that if we handed it out as a standard of care? The more structure we created in the distribution, the less delight we witness, such as in the prenatal classes. The profound experience of being the giver of this gift that could create not only delight for our patients and families, but think about our care teams being able to do this practice. And realizing that not one size fits all. Relaxation response can be very individual, so we have to be attentive to the option of modalities. So our goal is to expand access by offering our patients and their caregivers the experience of delight by adding this care kit to other groups at Penn Medicine. And by continuing to grow this program, we really see ourselves, patient access to these therapies will place Penn Medicine as a leader of patient-centered integrative care. So thank you, and as one more expression of delight, if you turn over your agenda and you have a purple sticker, you too will get a care kit today. So thank you very much.